Ever wondered how certain medications affect the body's nervous system? Today, we're going to embark on a fascinating journey into the world of pharmacology, specifically focusing on anticholinergic and neuromuscular blocking agents. These might sound like big, complex words, but don't worry, we'll break it down. Let's start with anticholinergic drugs. These are a class of medications that block the action of acetylcholine, a neurotransmitter that transmits signals in the nervous system. By blocking these signals, anticholinergic drugs can influence various functions of the body, such as heart rate, digestion, respiratory rate, salivation, and more. Now let's talk about neuromuscular blocking agents. These are drugs that interrupt the transfer of nerve impulses to muscles, leading to muscle relaxation or paralysis. They're typically used in medical procedures that require muscle relaxation, like intubation or surgery. So, why are these drugs so significant in medical practice? Well, their ability to manipulate the body's nervous system can be incredibly useful. Anticholinergic drugs, for example, can help manage conditions like asthma, incontinence, and gastrointestinal disorders. On the other hand, neuromuscular blocking agents play a crucial role in making surgeries safer and more effective by ensuring muscle relaxation. It's important to note that these drugs don't come without their challenges. Like all medications, they have potential side effects and interactions that need to be carefully considered. But don't worry, we'll cover all of that in the later sections of this video. In the end, the goal of understanding these drugs isn't just about memorizing their names or mechanisms, it's about appreciating the intricate dance of biochemistry that allows us to navigate the complexities of the human body. So, are you ready to dive deeper into this captivating world of pharmacology? I promise, it's more thrilling than you might imagine. Now stay tuned as we delve deeper into the fascinating world of these drugs. Anticholinergic drugs, what are they really about? Let's dive in and unravel the fascinating mechanism behind these drugs. Anticholinergic drugs are a broad class of medications that work by blocking the action of acetylcholine. Now, acetylcholine is a neurotransmitter, a chemical messenger that transmits signals across nerve cells. It plays a crucial role in a variety of functions in the body, including muscle movement, heart rate, digestion, and salivation. But how exactly do anticholinergic drugs block acetylcholine? Well, they do it by binding to a specific type of receptor called muscarinic receptors. These receptors are spread throughout the nervous system, and when acetylcholine binds to them, it triggers a response, such as a muscle contraction or an increase in heart rate. When an anticholinergic drug comes into the picture, it effectively acts like a gatekeeper. It binds to the muscarinic receptor, blocking acetylcholine from binding. This prevents the receptor from triggering the usual response, hence inhibiting the action of acetylcholine. There are various types of anticholinergic drugs, each designed to target specific muscarinic receptors in the body. Let's talk about a couple of common examples. First, we have atropine. This drug is often used in emergency medicine to increase heart rate in cases of bradycardia, which is an abnormally slow heart rate. By blocking the muscarinic receptors in the heart, atropine prevents acetylcholine from slowing down the heart rate, thus increasing it. Next, we have scopolamine. This drug is commonly used to prevent motion sickness and post-operative nausea and vomiting. It works by blocking the muscarinic receptors in the vestibular system, a part of the inner ear that controls balance and eye movements. By doing so, scopolamine reduces the sensation of motion sickness. But it's not all about blocking undesirable actions. Some anticholinergic drugs are used to promote desirable ones. For example, ipratropium is used to relax and open up the airways in conditions like chronic obstructive pulmonary disease, COPD, and asthma. It does this by blocking the muscarinic receptors in the airways, preventing acetylcholine from causing bronchial muscle contraction. In essence, anticholinergic drugs are like master manipulators, altering the normal functioning of our bodies in ways that can be therapeutically beneficial. They are a shining example of our ability to harness the complex mechanisms of the human body to improve health and well-being. So that's the gist of how anticholinergic drugs work. Now let's shift gears and talk about neuromuscular blocking agents. Now, are you ready to dive into the world of neuromuscular blocking agents? Imagine having a light switch that can turn off all the muscular activity in your body. That's what neuromuscular blocking agents do, but in a much more controlled and sophisticated way. They work by blocking the action of a neurotransmitter called acetylcholine at the neuromuscular junction. But what does that mean? Let's break it down. The neuromuscular junction is the point where your nerves meet your muscles. It's like a conversation spot where your nerves tell your muscles what to do. The messages are passed on through chemicals called neurotransmitters, and the primary one here is acetylcholine. When the nerve sends a signal, acetylcholine is released and binds to receptors on the muscle, triggering a response that leads to muscle contraction. Now, this is where neuromuscular blocking agents come into play. They are like party poopers. They come in and attach to the acetylcholine receptors on the muscle, blocking acetylcholine from binding. When this happens, the muscle doesn't get the message to contract, leading to muscle relaxation or paralysis. This might sound a bit scary, but it's incredibly useful in medicine. For instance, during surgery, these agents help relax muscles, providing the surgeon with a still and clear operating field. They are also used in intensive care units to facilitate mechanical ventilation, or to prevent harmful muscle spasms in conditions like tetanus. Now, there are two main types of neuromuscular blocking agents: non-depolarizing and depolarizing. Non-depolarizing agents like rocuronium and vecuronium act as competitive antagonists. They compete with acetylcholine for the same receptor sites but don't activate them, leading to muscle relaxation. On the other hand, depolarizing agents such as succinylcholine first stimulate the receptors, causing a brief twitch or fasciculation. Then, they stay attached to the receptors, preventing further stimulation by acetylcholine. This leads to a sustained relaxation or depolarizing block. It's fascinating, isn't it? How these agents can switch off muscular activity in such a controlled manner, and how this ability can be harnessed to help patients in various medical scenarios. However, like all drugs, neuromuscular blocking agents must be used judiciously and with a thorough understanding of their mechanism, benefits, and potential side effects. They are powerful tools in the hands of skilled medical practitioners, but they also carry the risk of misuse or overuse. Now that we have a handle on how both anticholinergic and neuromuscular blocking agents work, let's explore their uses in a bit more detail. So, where do these drugs find their use in medicine, you might ask? Well, anticholinergic and neuromuscular blocking drugs are like the unsung heroes in the world of medicine. They have a wide range of applications that are crucial in various medical scenarios. Let's start with anticholinergic drugs. These are primarily used to treat a variety of conditions that affect the nervous system. For instance, they are often used in the management of Parkinson's disease. In this neurodegenerative disorder, there's an imbalance between dopamine and acetylcholine, causing the characteristic tremors, rigidity, and bradykinesia. Anticholinergic drugs help in decreasing the effect of acetylcholine, therefore providing relief from these symptoms. In addition to neurological disorders, anticholinergic drugs also play a key role in treating respiratory conditions like chronic obstructive pulmonary disease, COPD, and asthma. They do so by relaxing the smooth muscles in the airways, helping to ease breathing. Now let's shift gears and talk about neuromuscular blocking drugs. These agents are primarily used during surgical procedures to induce muscle relaxation and paralysis. This allows surgeons to operate with less obstruction, and it also reduces the risk of involuntary muscle movements during delicate procedures. Beyond the operating room, neuromuscular blocking drugs also have a role in intensive care units. They are used to facilitate mechanical ventilation in critically ill patients. By blocking neuromuscular transmission, they allow for easier control of ventilation and prevent patient-ventilator asynchrony. Furthermore, these drugs are used in the management of conditions such as tetanus and status epilepticus. In tetanus, a life-threatening bacterial infection, the toxins produced cause severe muscle contractions. Neuromuscular blocking agents can be used to control these spasms. In status epilepticus, a state of continuous seizure activity, these drugs can help to stop the seizures. One more noteworthy application of these drugs is in the field of psychiatry. Anticholinergic agents can be used to manage the side effects of certain antipsychotic medications. These side effects, known as extrapyramidal symptoms, include restlessness, tremors, and involuntary movements, and can be quite distressing for patients. So, as you can see, anticholinergic and neuromuscular blocking drugs are not just confined to the pages of a pharmacology textbook. They are actively used in various branches of medicine, from neurology to pulmonology, from anesthesiology to intensive care, and even psychiatry. With such a wide range of applications, it's clear to see why these drugs are crucial in medicine. They help to manage various conditions, alleviate distressing symptoms, and even save lives in critical situations. Truly, the world of medicine would be quite different without them. But what about side effects and drug interactions? This is a crucial question that we must ask whenever we delve into the world of pharmacology. Just as anticholinergic and neuromuscular blocking drugs have their benefits, they also come with their own set of potential side effects and interactions. Understanding these can significantly impact how we utilize these drugs in medical practice. Firstly, let's discuss anticholinergic drugs. Common side effects can range from dry mouth and blurred vision to constipation and confusion. In more severe cases, individuals may experience difficulty urinating, rapid heartbeat, or even hallucinations. These side effects occur as these drugs block the action of acetylcholine, a neurotransmitter that plays a key role in many functions of the body. Next, neuromuscular blocking agents. These drugs are known to cause muscle weakness, which is their intended effect, but they can also lead to difficulty breathing, low blood pressure, and an increased heart rate. In some instances, they may also cause an allergic reaction. Now, what about drug interactions? Anticholinergic drugs can interact with a variety of medications, including antihistamines, tricyclic antidepressants, and certain Parkinson's disease drugs. These interactions can exacerbate the side effects and potentially lead to dangerous situations. Similarly, neuromuscular blocking agents can interact with aminoglycoside antibiotics, calcium channel blockers, and magnesium salts, among others. These interactions can enhance the muscle-relaxing effects of the neuromuscular blocking drugs, potentially leading to prolonged paralysis. In both cases, it's important to consider the patient's overall health status, the presence of other diseases, and the other medications they are taking. This holistic approach can help prevent unnecessary complications and ensure the most effective treatment. So, while these drugs offer many benefits in the field of medicine, they aren't without their risks. As with all medications, it's essential to approach their use with a careful balance of enthusiasm and caution. It's about understanding the potential rewards, but also the risks involved. While these drugs offer many benefits, it's important to approach their use with caution and awareness. After all, knowledge is the best prescription for effective and safe medical practice. Time flies, doesn't it? Let's recap on what we've covered today. We've embarked on an intricate journey through the world of pharmacology, specifically focusing on anticholinergic and neuromuscular blocking drugs. We started by understanding anticholinergic drugs. These are the substances that block the neurotransmitter acetylcholine in the central and peripheral nervous systems. They're like the bouncers of the nervous system, not letting acetylcholine into the nerve receptor party. This blocking action can affect various body functions, from the beating of our hearts to the digestion of our food. Next, we delved into neuromuscular blocking agents. These are the superheroes of the surgical world, swooping in to cause temporary muscle paralysis during surgical procedures. They work by blocking the transmission of nerve impulses to the muscles, effectively putting them to sleep for a while. We then explored the applications of these drugs. Anticholinergics have a wide range of uses. They treat conditions like asthma, COPD, gastrointestinal disorders, and even some symptoms of Parkinson's disease. On the other hand, neuromuscular blocking agents play a critical role in anesthesia during surgery and in intensive care units to facilitate mechanical ventilation. However, like all superheroes, these drugs have their kryptonite too. We discussed their potential side effects and interactions. Anticholinergics can cause dry mouth, blurred vision, constipation, and confusion, especially in the elderly. Neuromuscular blocking agents, while invaluable in surgery, can lead to muscle weakness and prolonged paralysis if not managed carefully. And let's not forget about drug interactions. Combining these drugs with others can either increase their effect, leading to overdosage, or decrease their effect, rendering them less useful. Therefore, it's crucial to monitor patients closely when these drugs are prescribed. Remember, understanding these drugs isn't just about memorizing facts. It's about understanding how they interact with our bodies. Until next time, stay curious and keep learning.